Thank you, sir. A very good afternoon, esteemed chair and esteemed audience. My topic for today is decoding patients' perspectives and preferences in glaucoma. You may think, why this not so run-of-the-mill topic? Actually, we are dealing with a disease which is the second leading cause of blindness, only next to cataract, which is irreversible but yet preventable. And the treatment mostly depends on the effective IOP control. There are advances in diagnostics and therapy, but still the prevalence is rising, and along with it, the economic and the social global burden as well. See, having the possibilities of detecting and treating the disease is just one part of the problem, and the other part is the behavior of the patient. This is mainly because glaucoma is an asymptomatic disease, where more than 50% of glaucoma remain undiagnosed. What happens in an asymptomatic disease is the patient's behavior is influenced by the patient's perceived susceptibility to the disease, perceived severity of the disease, perceived benefits of the treatment, and perceived barriers to the behavior change. Perceived is the word here. So a lot of patients don't readily have apparent symptoms, making it hard to convince them that they have a vision-threatening problem. Secondly, glaucoma is a chronic disease which requires lifelong monitoring and treatment. Adherence remains a major problem, more so in glaucoma, where the non-compliance range is from 23 to 60%. So here the understanding the needs and concerns of the glaucoma patient comes in, which can give us favorable outcomes if we strategize accordingly. Look at this study by Newman Casey, who looked into the most common barriers to glaucoma medication adherence. So the listed causes are skepticism about glaucoma-related vision loss, skepticism about medication effectiveness, poor glaucoma knowledge, poor self-efficacy, mistrust of the physician, difficulty administering drops, cause, side effects, forgetfulness, and so on. There's also a study done by Friedman et al., which looked into glaucoma adherence and persistence. So there is a patient's perspectives and a doctor perspective. You see the patient perspective, again the cost, forgetfulness, fear or denial, lack of understanding, and the doctor's perspective, lack of patient motivation to use drops, lack of patient understanding about the glaucoma, inability to communicate why compliance is important, and limited time spent. Just glance over the points highlighted in blue in this slide and also over the previous slide. What is glaring is the patient-provider communication gap. There is a gap in understanding of the disease, understanding of the treatment, benefits and risks. Also, poor understanding of the proper use of medication. Take, for example, the visual field defects in glaucoma. The conventional way of understanding and communicating to the patient is the patient sees blind spots or black spots in his field of vision, which will finally coalesce and cause blindness. But is this what the glaucoma patients see? This study by Crab on a view on glaucoma, you see out of the 50 participants, most of them saw blurred parts and 26 were unaware of their symptoms. None of the patients saw black parts or a black tunnel. The most common symptoms we often come across are missing letters or stumbling over the stairs or they're bumping into someone, etc. So the clinical diagnosis of vision loss may not be reflected in the visual fields and vice versa. Field loss may be invisible to the patient. Also, even when the parametric indices like mean deviation are comparable, you see charts of 7 people here with a mean deviation of 5 decibels, but the functional disability for the patient will vary with the spatial distribution as well as the depth of the visual field scotoma. So a lot of information is lost when we only consider the visual field indices. What I mean to infer by this is giving better visual information about the true symptoms to the patient may help the patient understand that he or she is really losing vision despite not being aware of that. This is one example of the image, what I mean to convey, so which will in turn improve the compliance. Coming to compliance, we just not want the patient to be compliant, like taking medication, but also adherent, taking proper dosages as prescribed, and also persistent. But the burden of using medications day in and out for a disease which patients don't believe they have, cannot feel or self-monitor the consequence of progression is not many of us are giving a thought. There is a lot of deal about using eye drops regularly. Also, administering eye drops is not easy. Most of our patients are old and more than 10% miss the eye completely, maybe of the dexterity problems or inadequate vision. Also, the side effects of medications play a major role. Glaucoma as such, which is asymptomatic for the patient will become symptomatic because of the side effects of the drops. Cost, including direct and indirect cost, is not which many of us give a thought. I will not dwell into details. I think the next speaker will be covering on these aspects. So what is important is we should understand the impact of glaucoma on quality of life, the psychological toll, like diagnosing a blinding condition which can cause significant anxiety, fear, depression, visual repercussions, side effects of the treatment, and also the financial burden. Are we seeing it clearly? We are often used to claiming the success of glaucoma management with parameters like IOP, visual fields, and damage progression. But from the perspective of the patient, the other concerns may be far more important. Understanding this will help us to strategize the treatment more individually and improving the adherence. After all, the goal of glaucoma treatment is to maintain patients' visual function and related quality of life at a sustainable cost. So, are we doing enough? Let's bite the bullet. No. Look at this study which showed major of the doctors are either reactive or skeptical. They are least likely to detect and address the non-adherence proactively, or least likely to discuss glaucoma or the importance of treatment with the patient when initiating treatment. Final thoughts. By its nature, glaucoma is a perfect setup for patient non-compliance, be it diagnosis, medication, follow-up care, treatment delay, or refusal. And the consequences, unfortunately, are not felt immediately, but are delayed by as long as several years. So, a proper communication with the patient and his family. The first and the foremost time is the time of diagnosis. Just not tell the patient, ask for the problems, provide information, assess their views on treatment. Treating adequately to minimize progression. Target IOP is also about quality of life of the patient, be it simplifying the medication regimens, teaching proper drop application, tailoring it to patient's lifestyle, preferences, preservative-free and drops. Of course, there are advances in treatment which are opening up new avenues in management of glaucoma care, but right now medical management is still the cornerstone and adherence is the main issue. And let's not forget, let's prioritize the patient and not the disease. Thank you.
Thank you, Dr. Tanushree. One question I would like to ask, what is the most important thing which we should do while treating the patient actually for patient compliance?
First thing is actually conveying it to the patient about the seriousness of the problem.
Right.
That is the major barrier what we are having right now. Once the patient is convinced, then the next of the steps become easy.
Yeah, and what I would suggest is that after confirming or diagnosing the glaucoma, just spend few minutes more with the patient. Give him proper understanding of the disease. Tell him about all the consequences and tell him what will be the side effects of the medicines also. That is also very important because a patient will have to use the drops for lifetime. And so he will have to face lot of things. So it is very important point which she pointed out. Very nice presentation. Thank you, Dr. Tanushree.